The following program is a paid commercial program. Views expressed belong to its participants and are not necessarily those of the management and staff of News Channel 11.
As a dermatologist, I spend a lot of my time talking to my patients about sun damage, being out in the sun too much, getting too much light, tanning bed usage, and trying to repair with that. We actually use light in order to repair sun damage and other problems with the skin. There are three basic categories of light emitting devices that we treat the skin with. One is LED, light emitting diode, another is IPL, intense pulse light, and the third would be lasers. The first being LED. This is an example of a blue light or blue U. It emits a blue light. It's low energy, low voltage. You have to actually get very close to it, within about 12-24 inches for it to work. And with various colors, whether it be a blue in this case, or a red, or a yellow, or a green, we're able to affect the skin, the different colors of the skin, to repair. Sometimes with these, we'll use a topical agent to photosensitize further to activate. But this is just like the LEDs you see on your Christmas tree. Very low voltage, but very effective on treating milder skin problems. The second one is intense pulse light, IPL. I don't own any IPL machines here now because we have various lasers that are stronger, more intense, do a better job. But most medical spas will have intense pulse light machines. They're used for hair and veins and some photofacials too, repairing sun damage. They use a little stronger light source that emits photons, and with this they're able to use a filter to give a certain wavelength of light, so they'll track different colors. So they'll go after the browns for hair, or the browns for the brown spots. They'll go after the reds for sun damage, the dilated blood vessels, and the damaged skin. So they require goggles. Both of these require goggles, and they do have some side effects and complications, but that's more common to use. The last that we have a lot of, and these are your more industrial strength, these are the lasers. Everyone's heard of lasers. What are lasers? Lasers stand for light amplifications by stimulated emission of radiation. In other words, we take a light source out of some electricity, it bounces around in a medium, creating high energy. It's then filtered into a narrow beam of light, so it comes out as a column. So as it goes forward, just like a laser pointer, it doesn't deviate like a flashlight. It's straight ahead. Very high intensity. It also searches colors too. It searches reds, it searches browns, it searches greens, depending on what you're looking for, or blues. Or in this case, the CO2 laser, this searches for water. And so they work by creating heat. With this resurfacing laser, it looks for the water in the skin, it vaporizes it, creating a super steam, creating loss of skin tissue. So this is repair of bad sun damaged skin using a CO2 laser. With this laser, this is a pulse dye laser. This uses a red color, and it searches for red. So if we're trying to get leg veins or facial veins, it also does some browns, it'll do some blues, but by using this laser, we're able to go ahead and search out those colors and destroy them. Now, these are a little more uncomfortable. They have a higher side effect profile. If you're having somebody treat you with an LED, with a intense pulse light, or with a laser, make sure that you're wearing eye protection, because these all can affect the pigment in the eye, and they can lead to blindness. They can lead to a lot of other problems too. Also, when you have laser treatments, you do need to keep out of the sun for a good couple of weeks, 2 to 3 weeks afterwards, and probably a week before, because you don't want to overstimulate this damaged skin and create more pigment problems. So that it's very important that the doctor or the esthetician or whoever's treating you knows how to do the post-care results. But with light, we can treat light damage. Now, you want to protect yourself following that with sunscreen. So make sure following these treatments, you're on a good sunscreen regimen, and make sure that you understand what causes it and how you can repair it. But usually most medical spas, they have trained personnel, trained professionals. Make sure there's a physician available, not necessarily under roof, but at least available, that knows what they're doing, that they can go ahead and take care of any complications that do occur, because there are complications that occur, rarely, but usually they can be very easily managed if they're addressed very quickly. So that if you have any problems, any questions about these, come to the office. I'd be happy to sit down and talk with you about how to repair the skin, what treatments are available. One size doesn't fit all, but we can take care of your problem.